DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there and welcome to DocTalk. Glad you joined us today. We're going to have a great show. I have Dr. Nels Lindberg, a veterinarian from Great Bend, Kansas, and the owner of the Animal Medical Center in Great Bend, Kansas. We're going to talk about preconditioning calves and preparing those animals for transport in the beef industry. Sure glad you joined us today.
In the last 3 years, we've changed some things in our AI protocol, one of which was the use of multi-min. We've seen a significant increase in our AI pregnancy rate. The cost of an embryo program is significant, and we feel that if we were able to even get one more pregnancy out of a cow, that would pay for the whole cost of the whole bottle of multi-min right there.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Nels, welcome to the show.
Thanks for having me.
This is Dr. Nels Lindberg, who's a veterinarian from Great Bend, Kansas, and he's the senior partner of Animal Medical Center, and you're also a part or one of the veterinarians in production animal consultation. And as we were talking before the show, this is a group that consults cattle internationally, different species as well, not just cattle, but pigs and dairy as well. But 1 out of every 10 steaks is under y'all's care.
Virtually just shy of 1.5 million head on feed, which would be equal to about 1 out of every 10 steaks on every plate in America.
That's amazing. Your group does a lot of great work out there, not only for the producers, but we appreciate what y'all do for us here at Kansas State University as well.
Well, we're glad to do it and glad to cooperate with Kansas State University, and together we can do better.
You bet. Well, today we're going to talk about a topic that's pretty near and dear to both of our hearts, and that's preconditioning calves, or preparing those calves on the ranch for market through our marketing system. And let's just start out with some of the things of why is preconditioning important?
Well, preconditioning is, a strategy that's been around for a while, since probably the, first talked about in the early 80s, mid 80s, that they talked about in Iowa. Just a protocol or vaccination protocol to get calves ready to go on to the next stage of their life, that typically being a starter yard or some feeding situation of some kind. We know through both experience and data that preconditioned cattle do better than non-preconditioned cattle in a confined feeding setting. So in the end, that's why it's important, is they do better from both a health and performance standpoint, preconditioned versus non-preconditioned cattle.
I hear the non-preconditioned cattle sometimes called opportunity cattle, mismanaged cattle. And really when we're talking about this is that high-risk calf that's abruptly weaned, no vaccination history.
Yeah. I mean, there are cattle that get pulled off mama cow, and they get ran through the system and sold and wind up on our end, and it's a stressful time in their life.
You bet. And then they come walking in here. They're not only naive from a viral antigen or bacterial standpoint, but naive kind of the ways of the world and being handled and lots of different things. Where feed comes from.
That'd be correct. They don't know exactly the kind of water tanks we use and what they are. They're not familiar with a bunk, not familiar with a pen setting.
Well, no matter how you slice it, doing the right thing, managing these calves is important. I know you feel that way and you see it every day.
Absolutely, that's correct.
Well, thanks for being here today. Thank you for watching DocTalk. We're going to continue with Dr. Lindberg here after the break. You've been watching DocTalk, and we're sure glad you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs. Whether you're looking for power, with a Power Stroke diesel. Or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook. Specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle, Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there, welcome back to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. I'm joined today by Dr. Nels Lindberg, who's a friend and colleague. He's a veterinarian from Great Bend, Kansas. He's a senior partner of Animal Medical Center, and he's also in a partnership with Production Animal Consultation Group, which is located in many states, and they do a whale of a job of consulting feed yards, dairy, swine operations, and such. And just great to have you here and be able to spend time with you. When we started talking about preconditioning programs, and I know that you're very passionate about doing the right thing for the cattle, what are some of the things that you like to see producers do in these programs, or what are some of the different programs, and how should we do them?
Typically, you know, the preconditioning program that we're vastly familiar with is what we do in the fall. But we first got to back up to the springtime, and that's in a spring calving situation.
Right.
But in the springtime, if it's a springtime calving situation, you know, what do we do at branding or, you know, prior to turnout? And so oftentimes that's a time frame that gets left out, and cattle may get nothing in the springtime at branding, or they may get blackleg, or they may get, you know, a couple other vaccines. But it's very important that at minimum those cattle get a blackleg then, but also a viral vaccine. And we use a fair amount of Pasteurella at that point in time as well in those calves.
Sure, and when we talk about a viral vaccine, we're talking about the respiratory viral, the IBR, BVD, PI3, BRSV, and you know, when we start to think about Pasteurella and these vaccines, we're really trying to lay the groundwork. It's when the maternal passive immunity from colostrum is waning, and we're starting to get that vaccination in those calves to prepare them for weaning.
That's right. We still, there's probably some calves that have some maternal colostrum. We still go ahead and we recommend to get that viral vaccination into them, and we do use a fair amount of Pasteurella in those babies to ward off some of those summer pneumonia situation in those babies.
So then let's get to the traditional side of the preconditioning program. And this is going to come when these calves are 6-7 months old. Might be a little earlier with the drought and different things of that nature, but what are we looking at this point in time?
At that point in time, it kind of depends. Are we going to wean them on the cow? Are we going to start our preconditioning on the cow? Or are we going to start the preconditioning at weaning and when they're off the cow? And so either way, we believe and feel, and the data is there to prove it, that they need 2 rounds of shots in the fall. both your viral and pasturella. Now there's different programs out there that have different stages of number of shots you give or how many you give or once or twice. But twice is the best, and 2 rounds of modified live, 2 pasturella.
So you're going to give that at the time of weaning and then come back how long?
Oh, we typically, it depends on the operation, but 14 days is kind of your average time frame.
Cool. Well, we're going to take a break, and when we come back, let's get more into these programs and what your recommendation is for preconditioning these calves.
Sounds good.
Appreciate you being here. We appreciate you watching the show too. After the break, we'll be back with more with Dr. Lindberg on preconditioning calves. You're watching DocTalk, and we're sure glad you joined us.
This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi folks, welcome to the Farm Animal Tip sponsored by Bear Animal Health today, and we're going to talk about fly prevention. Why is fly prevention important to you? 2 reasons. 1, disease control, and 2, performance. Flies can take pathogens from farm to farm, whether it's pathogens that may cause disease in cows or foodborne pathogens such as E. coli. And then production, biting flies and things to that nature have been shown to decrease the performance of the cattle within your herd. So controlling flies, we want to make sure that we get rid of vegetative places of rotten material, cut down the weeds so that they don't have a place to nest, and then you want to use a good fly bait or some sort of control. Work with your local veterinarian to design a plan to decrease flies on your farm this summer. And you've been joining me for the Bear Animal Health Tip of the Day. Thanks for joining me.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Getting ready to work cattle for pre-breeding and calf vaccinations? There's no better time to use a safe, modified live virus vaccine to prevent BRD. Titanium provides the correct equation for BRD with its excellent safety profile and a strong response and long duration of immunity. Ask your veterinarian about modified live virus vaccines and the 8 convenient combinations of titanium for the perfect pairing of performance and value.
This segment is brought to you by Purple Wave Auction, the easiest, most straightforward way to sell used equipment. Purple Wave, straight, simple, sold.
Hi there and welcome back to DocTalk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, joined by Dr. Nels Lindberg, who is a senior partner, veterinarian and senior partner of the Animal Medical Center in Great Bend, Kansas, and he is included in a group of veterinarians called Production Animal Consultation, which is located around the United States, mainly in the central High Plains region, but they cover all species, swine, dairy, and feedlot, cow-calf consultation, and good partners with Kansas State University. And we're talking about preconditioning, Dr. Nels. And yes, when we kind of left for break, we'd talked about using, viral vaccines, bacterial such as Mannheimia and Pasturella, and then Clostridial or blackleg vaccinations. But what are some of these, and making sure we get 2 rounds of shots, but what are some of the other things that we would be looking at doing during preconditioning?
Well, we need to provide a castrated steer calf or bull calf. He needs to be castrated, and then we also want to dehorn the calves that have nubs or little horns. So we want to provide a castrated and dehorned calf.
In your experience, at the feedlot level, buying a castrated steer or bull versus an intact male calf, is there a big difference in death loss? Or
huge, and that difference has risen actually. Some of the recent data I just put together last week for a presentation, I used to always say, and the data used to always say, morbidity and mortality was double
for bulls
versus steers.
If you have to castrate them at the feedlot versus one that's already castrated.
Yeah.
Well, what are we seeing now?
Now the data that we put together showed morbidity actually was the same. Bulls was twice the morbidity as the steers, but mortality was anywhere, depending on the weight class, 3s and 4s, anywhere from 3 to 5 times the mortality of their steer mates.
So when you're purchasing intact bulls and you're going to cut them at the feed yard compared to buying steers, you need to factor in the cost that you're going to double the sickness rate for bovine respiratory disease and have 3 to 5 times the death loss.
That's right.
Wow, big difference.
Yeah, well, it's a sizable, significant difference.
So then what are some of the other things that we're going to do when we precondition these calves?
We want to make sure we deworm them. We know parasites are immunosuppressive. We want to get rid of the parasites in those babies so they're ready to go and cleaned up, and also so if you, in your preconditioning program from the nutritional aspect, that they will have a better performance as being a dewormed calf. Also from a mineral standpoint, any calf coming out of a drought region, sometimes maybe there is a need for an injectable mineral. I do it routinely in Herefords. We see a lot of Herefords at one particular yard and feel like a mineral injection is beneficial to their immune system and health.
Cool. What about steroid implants?
It's a great product. It needs to be used, and that's how we gain our pounds to pay for this program.
Yeah, I think that's one of the myths of people saying I don't get paid for preconditioning. If you get the same price for a preconditioned calf versus non-preconditioned calf, and you got more pounds, you got more money.
You got more money, and as long as they're not too fleshy.
Thanks. And thank you for joining Doc Talk. We'll be back in a minute.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
A K-State animal scientist had the opportunity to speak at the Southern Plains Drought Summit in Pratt, Kansas. With Ag AM in Kansas, I'm Devin Stewart. Justin Wagner says that as producers plan for the upcoming grazing season, with the prospect of continuing drought conditions, producers should consider the merits of supplemental feeding cattle on drought-stressed pastures.
The key thing to focus in on is that our primary need to cows on drought-stressed pastures in a limited forage availability situation is really energy instead of protein, and so that changes the picture in terms of how we price our supplements. They need to be priced on a cost per unit of TDN or a cost per unit of net energy for maintenance value as a way to compare a number of the different supplements.
With Ag AM in Kansas, I'm Devin Stewart.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Getting ready to work cattle for pre-breeding and calf vaccinations? There's no better time to use a safe, modified live virus vaccine to prevent BRD. Titanium provides the correct equation for BRD with its excellent safety profile and a strong response and long duration of immunity. Ask your veterinarian about modified live virus vaccines and the 8 convenient combinations of titanium for the perfect pairing of performance and value.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations.
Hey there, folks. Welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm meeting with one of our alumni from Kansas State University and an avid Power Cat fan, Dr. Nels Lindberg. He's a senior partner of the Animal Medical Center in Great Bend, Kansas. He's a veterinarian. He's also part of a group called Production Animal Consultation, which covers dairy, beef, and swine internationally. And we're talking about preconditioning. We've had a great discussion on what we want to do to prepare these calves and make sure that they're bunk broke and water tank broke, and they have them, 30 to 45 days to acclimate, and then we go through the market segments. But we still have some resistance out there, people wanting to precondition, and what are some of the things that hurdles that we have to get over?
Well, probably the biggest hurdle is it costs money to precondition your cattle, and we can't get around that. That's just a simple fact of life. So in order to precondition, we've got to make it pay.
You bet.
And if we wean them for 30 days, 45 days, that means we've got to probably feed them something, and that costs the producer money.
Mm-hmm. Well, I think that we see that, and we understand the cost, we understand the labor, and but when we get down to it, again, the publications that are out there, people are getting paid now for preconditioning, and when you start to look at some of the stuff done at Purdue and some of the different universities showing that, over a 10, 11-year period, there wasn't a year that preconditioning wasn't more profitable for ranchers than non-preconditioning.
Yeah, you get paid through, more vaccinations given. You'll get paid for that. We also get paid for pounds, and we know that implants put on pounds, and that's how we ultimately really get paid. The third thing is adequately marketing those animals. If you take your animals to a regular day at the sale, he may not get a premium on that. Now, if he's got extra pounds, that is his premium. But if you do both things, you take him to a special calf sale at the sale barn or whatever, and you market them appropriately, you get a premium for the vaccinations, and then you also get that premium for extra pounds that you put on those animals.
Yep. And the other thing is that it's got to be sustainable, it's got to be profitable, but for the sustainability of our industry and moving forward, something we're going to have to think about when people from the outside are looking in.
That's right. It's got to be sustainable. We've got to do the right thing. As I told some producers last week outside of Houston at a producer meeting, that were throwing eggs at me for it didn't pay. If you're not doing it as a producer, your neighbor's going to be doing it, and your neighbor, if he's doing it for sustainability or long term, he's probably going to be the one that's there long term.
Yep. So it gets back to doing the right thing.
That's right, doing the right thing and getting these cattle to the feed yard at the right time with the right vaccinations and in good health, prepared to move on and do well.
Appreciate you being here today.
I'm glad to be here.
Appreciate you watching DocTalk. If you want to know more about what we do at the College of Veterinary Medicine at Kansas State University, you can find us on the web at www.vet.ksu.edu. Remember, always work with a local practitioner. I'm Dr. Dan Thompson from Kansas State University. You've been watching DocTalk. We're sure glad you joined us, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
DocTalk, produced in cooperation with Drovers Cattle Network and Bovine Veterinarian. For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
As a manager of grazing beef cows, the thing that's always bothered me about standard trace mineral supplements is that we put them out for the animals to consume, but there's no guarantee that the animals will consume them in the right amounts. Multimin 90 allows us to address at least 3 specific trace mineral issues that we have here in the Flint Hills. Other grassland types here in Kansas, the midgrass prairie in the central part of the state and the shortgrass prairie out west, have their own mineral issues. Multimin 90 matches up with those as well. Trace mineral supplements are also heavy metals, and we have to be careful how we use them, how much we put into animals that might potentially find their way into the human food chain. Multimin 90 is an FDA-regulated product. It's important to follow label directions in terms of dosage and route of administration. The route of administration is subcutaneous, usually in the neck area. There are no risks for injection site lesions, or minimal risks anyway for injection site lesions if used appropriately. What I like as a livestock manager about Multimin 90 is that when I apply that injection, I know that the animal is receiving the 4 critical trace minerals, selenium, copper, manganese, and zinc, at exactly her requirement. I know exactly how much is getting in. In our trial at Kansas State University, we used 460 mature cows. Half of these were injected at preg check time during the month of December, and again about 4 weeks prior to breeding. The other half of the cattle received a saline placebo. We then monitored reproductive performance during a single timed AI event and the subsequent natural service breeding season. In our study, we got 9% greater AI conception on the treated cattle than on the cattle that received placebo, and our calving distribution was shifted farther forward into the spring in the treated cattle as opposed to the untreated cattle.